It means a lot to me to get natural looking results. Tummy tucks ideally have the lowest scar possible and a hidden belly button scar, ideally at the bottom of the belly button or not at all. For patients who don't have a lot of extra skin above the belly button, I have a technique in which we go in through a scar lower than the C-section scar, within the tiniest bikini you would ever wear, and through a tiny tunnel, repair the muscle, separate the belly button, but then place it back without putting a scar on the skin. This is what I call the Hollywood tummy tuck. I learned some of these techniques when I went down to Cartagena in South America. They have beautiful results for patients of color. They have a lot of patients with that skin type, and they have done some really incredibly innovative things. For patients with middle skin tones or darker skin tones, whether Asian or Latin or African descent, I think this is critical. For patients who have excess skin above the belly button and below, I'll use a technique in which we pull the upper tummy skin down all the way like a window shade, getting a very low scar. But to get it even lower, I have techniques for softening with liposuction laterally. It gives a nice finesse and an athletic contour. It helps lengthen the waistline by getting out that flank fat and those boxy muffin tops. But additionally, it helps get the scar even lower. And we have a few other techniques in which we use these little special sutures that give that finesse and help bring the scar and hold the scar down as well, because we don't want that scar riding up, so that's really important. When I have to pull the scar down and make a new belly button, though, I'm really proud of the artistry of our belly buttons in which we get that belly button scar all the way down on the fascia, tucking the outer skin down to meet the belly button stump at the fascia so that the patient can wear a bikini once they're totally recovered. This is especially critical in patients of color or patients who have a risk of scarring darkly.